your name and the organization that you represent in the chat so we can keep track of who's attending these sessions. Today, you can see the agenda here. We're going to talk about the PPR and PFRs, what we receive, the good, the bad, the ugly of it. We're going to talk about the training setup in Worknet. We're still having some people that have not completed that, so we're going to go through that. David is going to go over the contact list. Our list has grown exponentially and it keeps changing. So we are setting up a system where you guys will be responsible for keeping us updated on contacts. And then you'll be responsible for sharing information for the appropriate people to attend specific sessions. And then we're going to do another quick overview because there's been a lot of information thrown at you regarding the system. So David's going to do another quick overview of the intake and case management system walkthrough. But if you have specific questions, we want you to be able to ask those at this point. And then we're going to talk about, meetings and what we're going to be doing moving forward, because we're going to start breaking the groups out a little bit more. So we'll go through that, and we're going to have specific program managers that'll be working with you guys. So we'll go through that. So right now I'm going to turn it over to Rosa. She's been taking care of the reports, and she can kind of let you know the status of that and the things that she's found, when she's going through this. So go ahead, Rosa.
Okay. Good morning, everyone. First of all, I just want to say thank you. All 44 grantees have submitted their reports now. So I'm very grateful to have all those in. I wanted to thank you for that. If I have processed your report already, you'll receive an email from me letting you know that the reports have been uploaded into eGrants for processing, that we're moving them along, and that's pretty much your cue that everything at that point is okay for the submission. So if you haven't received an email from me yet, it's because I'm still in the process of working through all of these grants. I'm a little more than halfway through the reports, and so you'll be hearing from me, shortly. We have found several reports, I'd say more than half, that I've had to reach back out to you, that the reports had to be resubmitted for one of many different issues. I think the most important, the first issue that you really need to make sure is that the person signing the reports, or basically we're accepting electronic signatures or just a type signature at this point, that they do have signature authority to sign the grant. And what that means is when you received your grant agreement document and the person signed the document and returned it to us, and then we sent you back an executed grant agreement, that's the person that had signature authority. And if you added additional signers, there was also a page that you could add additional people to designate them as authorized designees to sign the grant. Then what we do is we keep that information in our eGrant system, and we verify that the people listed or just the initial authorized signator has the right to sign for the grants, and that includes all the reports. So if there are other people, like you have your finance manager signing one report and the PPR is by a different person, that's fine. We just need to have that in our system. So if we don't have authority for that, I've had to reach back out an email saying, okay, these reports need to be resubmitted because the person on there doesn't have authority to sign on the grants. So if you think you might be wanting to add more people, just send me an email and I will give you the form, and then we can get those people added. Another issue that we found were we weren't getting 4 separate documents. I think it could be a little confusing because we had a cover page, 2 cover pages. We had the trial balance cover page, and then we also had the PPR supporting documentation cover page, along with a PFR report and a PPR report. But all those documents have to be submitted separately because we upload them separately in our system. And especially working, from home remotely, we don't have access to being able to print things, reload, and do that type of thing. So that was another issue. A third thing was the report end date. Every quarter when you submit a report, it is going to be the last day of the quarter. That's going to be reported on the end date for your quarter on the report. So I only had a couple of those where it got a little confusing and they were putting down the submission or due date instead of June 30th, 2022, they were putting July 15th, 2022, or the date they created the report. Another really important piece for us is the naming convention. Tammy had sent out an email, I think a couple different ones early on, with a lot of information, but had the naming conventions. And it's really important that we stick to those exact naming conventions, because when we're dealing with so many different reports, it's just easier for us to find that information, and also to have 4 different reports and constantly naming things, 44 grantees, it gets to be very time consuming on our end. And we would just ask that you would just really review those before you name them, and send them to us how we would like to have those named. And then the last thing that we found with these submissions was Tammy had asked that you put in the body of the email when you submitted just a little phrase that she included, that because we weren't putting information into the system yet with Worknet, had no customers yet added, and no costs reported, that there was no supporting documentation included in the submission. And I think some people forgot to include that, so I've had to reach back out to you to include that. So, at this point, because I had so many people that did not or were not able to submit their reports without any issues, and I had to reach back out, I just would like some feedback. If you are any suggestions, if the instructions were confusing, or if there's something going forward. I know this was just the first time and it was a little odd. We were in the middle of our rollover period. So a lot of these issues won't reoccur, but if you have any suggestions or comments, please let me know, or put it in the chat or email us. We'd love to help you going forward. And that's all I have.
Thank you, Rosa. And we will be doing a training session in September, because the next quarterly report will be due October, I think right around the 30th. So in September, we will do another TA session, because there will be supporting documentation that will be required for that. And we'll show you how to get the information out of the Worknet system and also out of the GRS system, along with your trial balance that will be required. So yeah, and if you have any questions, like I said, reach out to Rosa on that, if you have, or suggestions for sure. Or you can always put them in the chat. So I am going to right now.
Tammy, can I ask?
Yes.
So every month, what are the reports you're looking for as far as billing and program?
Okay,
finance?
so there's not a monthly report requirement. At this point, we have a quarterly reporting requirement with the PPR and the PFR. However, you will be putting, it's required that you put your clients in the system. So once you start working with these, your clients, we need for you to start putting in the system. We are finalizing our manual, and we do have some timelines around that. So once they're enrolled, we like to see them, I think it's like 10 days after enrollment to, to make them eligible and start serving them. And we'll go through that with the manual when, we have it, completed completely. But you need to make sure that you're being timely and entering your clients in the data system, which is the Worknet system. And then you need to be timely in reporting your cost. Granted, we're behind right now because the grants just got started in June.
Oh, okay.
And I heard somebody talking there. And we're going through the rollover process. So you didn't have access to the GRS. You now have access to the GRS to put your costs in, but you can't do cash yet, because the rollover has not happened, but you can do costs now. So when you go into the GRS and put your cost in, one of the things I had a question actually yesterday on that, we have sublines under like personnel. We may have like a 1,000 as the personnel line where the budget resides. So your total budget's in that. But then we have it broken down between youth and adult, because we need to track between what's expended on youth and adult. So if you have an adult program, then you're going to put your costs into your adult line item. And it's going to show a negative in there. And so, but don't worry about that, because basically it's going to roll up to that total amount. So if you have an adult and a youth program and you're putting personnel costs in it, you're going to put the costs associated with the adult under adult, the costs associated with the youth under a youth, and that'll roll up, and the total costs will be taken from your 1,000 line item, which is your personnel. So if you see a negative in there, that's just the way our system is designed, unfortunately. But we can have Josh walk through that at a training session too, now that we're going to hopefully be able to be getting information in the GRS and start doing cash and cost. And we'll have Josh do a session on that, so you know what it looks like and you're not worried about that. But with that said, monthly reporting is just making sure your clients are in the system, making sure you're being timely on reporting your costs, and then requesting your cash. And your expenditures have to be put in by the 20th. So like this is July 21st. So anything that you report now will go into the July month. So like if you reported anything July 20th and before in July would have been in the June expenditures. Now we're in the July expenditures. So anything you report from now until August 20th is going to be considered like in the July bucket. But right now we're doing catch-ups. So pretty much everything you're going to be reporting is going to be in the July bucket because we're going to be catching up. And then from there on, you need to be timely in reporting your costs, by the 20th of each month for the prior month's expenditures. So kind of got off track on that because off of our agenda, but that's it. So the quarterly reports are quarterly, and they're the PPR, PFR, and supporting documentation. Monthly is just making sure you have your data on your clients and your expenditures and the appropriate systems. And then we will be reporting, the state will be reporting on a monthly basis to Gambi. But we'll be getting that information out of the GRS and out of the Worknet system. So that's why it's critical that you're timely in reporting in those two systems so that the information we're providing is accurate. Does that make sense?
Yes.
Okay.
Yeah, Tammy, could you just say the part about the cost reporting? Right now, we can put costs in, but not cash in the GRS currently, and we want to make sure that all of our info is in there by the 20th of each month for the month prior? Is that
Yes.
Okay.
Exactly. Yeah.
I'm-
So right now we're past the
I'm
20.
prepping these to share with finance team, so I want to tell them the right thing.
Yeah, exactly. Okay. So any cost that you're putting in right now is going to fall in our July bucket in our GRS system. So, but you need to make sure you're caught up on all your costs.
Thanks.
Because you may have some, we have a pre-awards, you may have some in April, May, June. That's all going to fall in our July bucket. Okay, I'm going to go ahead and do a new share now. We're going to move on to the next topic, which is the program setup. So if you take a look at this, if you're green, you're good. There's a few comments I've got on some of the green ones. If you're in the orange sector, you have not entered any programs in the Worknet system. And then if you're in the yellow sector, there's some stuff that is needed before I can approve it. And I can kind of go down this list. One of the things I want to tell you guys, if you are in the orange sector, we're not going to be approving any cash requests until you've got your information in Worknet system. Because it's critical. You can't put clients in if you don't have programs in there. So if you see your name as not entered in the orange, you need to get with David and Natasha, and you need to get your program set up in the Worknet system. And they have open office hours. So, this has been about 3 weeks since they had their original open office hours. So, we need to get that in. And like I said, we're not going to be approving any cash until those are in the system. Like I said, the yeses are good. Bella, we're going to work with you. There's just a couple little quirks in your program, so we'll work with you offline on that. So that's not a problem. I've been talking with Chicago Women in Trade. I've approved yours. There's some credentials that they're waiting on getting the information, and we've had that conversation that you're going to upload that as soon as you get, but yours have been approved. If you have anybody from Comprehensive Community Solutions, you need to add your credentials to all of your programs because I didn't see any credentials. And once the credentials are added, I can go ahead and approve those. And if you have any questions related to that, just reach out to me in an email after the call. Cunningham, I've approved yours, but you need to make some name changes in the programs. And then in your program implementation plan, because I'm comparing these to your program implementation plan, it looked like you had an apprenticeship program in there that's not in Worknet system. So that's just a question I've got on that. But mainly what I say, changing the names, the name of the program should be the type of program you're providing, and it shouldn't be like, and I don't know if yours is named like this, but it shouldn't be like Cunningham Children's JTED program. It should be whatever the type of, if it's going to be like manufacturing, skills upgrade, whatever the program name is. So when we're looking at the program, we know what the training is about. Once again, we've got EDR good. Evanston needs to put theirs in. Governor's State, you still need to add your medical billing and coding. That was included on your program implementation plan, but I didn't see it in the system. Okay, Inspiration Corporation, you need to add credentials to your training programs. I didn't see any credentials on any of them. On Jane Addams, the programs didn't match up to the program implementation plan. So, and I think a lot of that was the numbers of people being served. So take a look at your program implementation plan and then look at what you put in Worknet and make sure that those align. Same way with Leicester Annexer Center. Your programs don't match what was in your program implementation plan, and I didn't see any credentials in there. So once again, look at those program implementation plans, make sure they align, and then get your credentials in. Matricon, it looked like you guys just had one program that you need to add, your accommodations training program. You have one in there, but that one is in your plan, your PIP, and I didn't see it in the system. Okay, we've got National Able. There was only one change we need. I think you had like 52 people served, but your program implementation plan was saying 54. So you need to take a look at your numbers served in Worknet and make sure that it aligns with what's in your implementation plan. Once again, Revolution Workshop, the main thing is the way you're naming your program. It just doesn't really identify what the program is. So take a look at how you name that. I went ahead and approved it, but take a look at the program name and make it, identify with what the training program is you're providing. Ram Joy, we need some clarification around the programs. It's different than what's in the program implementation plan. And this is probably something that we need to have a conversation outside of this about. Southwestern Illinois, you need to increase your radiological tech to 3. You've got it at 2, but in your program implementation plan, you had 3. So that needs to go up to 3. And then you need your credentials for your respiratory care. I've approved those, but those need to be updated in the system. And then Youth Job Center. Once again, change the program name. So it's not, I think you put like the name of who's providing the training on there, but change the program name so we understand what the program is. And the numbers served in Worknet is over. You actually are over excelling in Worknet than what you had on the program implementation plan. And that's fine. We're okay with over. We just don't want to see anything under. But your number was just slightly over what you had in your program implementation plan. So if you needed to change that, you could. But like I said, once again, if you're in this orange, get this information in, because we're not going to be approving any cash requests until we have this set up, and you can't put your customers in until it's set up. And if you're not doing that, then we're not going to be able to report appropriately or correctly to GOMBI, and then eventually to the Treasury Office, the federal side, on what we're doing as far as our performance is concerned. So does anybody have any questions on this before we move on?
Yes, Tammy, this is Kim from OAI. I'm in finance, but I'm trying to figure out what is it that we haven't, we have a not entered. So what is it that we need to be submitting that programs haven't submitted?
Okay, so this is on your client side, and this is in the Illinois Worknet system. So this would probably be more programs instead of finance. Your finance, you're dealing with GRS, but whoever's going to be running the program and doing like the data entry for clients, right, would probably be the one that you need to communicate with if they're not on the call, and let them know that they need to get their program set up in Worknet.
Okay, thank you.
Hi, my name is Hong Liu. I have questions. Sorry. Regarding the enrollment. And then, so first, what documents we have to keep on file for the students enrolled in the system? What supporting documents we need exactly?
Well, you're going to want to keep, and we're going to have a session on this too, as far as we're putting together a checklist for your file structure. JTED is relatively easy when it's coming to eligibility. So we're going to want to know if it's a youth program that they're eligible to, they're within 16 to 24, that they are eligible to be in a youth program. We're gonna want to know that they're eligible to work in in Illinois. We're gonna want to know, and documentation of that. We're gonna want to know that if they're a male 18 or over, that they're registered with Selective Service. And then we're going to want to know if they're in a QCT or DIA, but that is also determined within the system. So you wouldn't necessarily need documentation on that because the system looks at their address and it determines if they are or not within Illinois Worknet. We're going to want to know their income, whether it's low or moderate, because that's one of the elements we need to report on. So we'll, want to have income verification with that. I think that's pretty much it. That's the big buckets of what we'll need.
Okay, for the income verification, do you require their pay stub or monthly or biweekly or weekly, or you have to have their annual tax return? So what kind of exactly documents that's acceptable? Because people have all kinds of income, especially for the low people.
If you go to, and David can pull this up, if you go to our resource, we have a document out there that shows documentation that can be used for all of these different things. So David will walk you through that, when he's going through the contact information and going through the intake and all of that and show you where that's at. So I would reference that document.
Wonderful.
What's eligible.
Great. That's great. And the other question is that once the student was entered into the system, is there a time frame that they need to start the training?
There's a time frame for enrollment. Like once you've done your orientation, it was 10 days that we want to see them, enrolled. And then there is a time frame for providing a service. It doesn't not necessarily a training service, but what you'll do is in the system, if you're going to do occupational training, you're going to add that service as occupational training. It doesn't mean that's starting there. You can add the start date. So you can say they're going to get occupational training and it's going to start in August 1st is the start date for that. So we want to see, or you're going to be providing case management. So a service needs to be attached to that customer. And I believe it's within 10 days of enrollment. But it doesn't necessarily mean that the training has to start.
So in the system, there is a field that we can put, when do they start the services?
Yes. Yeah. And we'll walk through that. David can do a quick walkthrough of that too, so that you can see that.
I see. So unless the students are ready to start within 10 days, otherwise we should just not enroll them unless.
No, you should enroll them. And it doesn't necessarily mean it has to be an occupational training. It could be case management. You just have to align them. You have to be doing case management. You have to be working with these clients within a specific time. So we'll walk through that in a second when we go into the system.
Okay. Sounds
Any
good.
other questions on this particular item?
I have one, Tammy. This is Sherry from the YWCA Metropolitan Chicago. I don't see us on the list.
Metropolitan Chicago, right here.
Yeah, okay.
You guys are just doing barrier reduction though.
Okay, just wanted to make sure we were good.
Yep. So the NAs that we have on there, that's barrier reduction only, and it's not applicable to you.
Okay, great. Thank you.
Mm-hmm. Okay, I am going to go ahead and stop sharing my screen. And the next thing we've got up is our contact list. So David, would you mind walking through that? And what we're going to do, you guys are going to be responsible for this information and to keep it updated. And this is going to be what we're going to be using from here on out to send out information. So go ahead, David.
Yeah, thanks, Tammy. So with this tracking spreadsheet here, the first column we have the names of all the grantees, but in the subsequent columns, we have 3 different areas. And what we want to do is centralize our distribution list when it comes to reaching out to all the grantees, when it comes to things related to Illinois Worknet, and also financial. And in the first column, in the first column here, we have let me share the link here. So this is a link to a Google Sheet that we're going to ask you to track and update. You should be able to access it with the link and be able to enter this information. But what we're going to ask you is, for your grantee, for your row to enter in, the primary contact name, contact email, and contact phone, as well as a secondary contact and that same information. And these first columns here that I have highlighted, these are going to be more for entering information into Worknet. So, the customer enrollment and career plans and, all that information, that's going to be Illinois Worknet based. And then we have a few columns, these last three here, these are going to be more financial based and, GRS, those sorts of things there. So we have one point of contact here. And, when we do, update meeting invites or send out emails, depending on what it is, whether it's Worknet or, on the finance side of things, we'll send the emails to, the contacts that we have listed here, and then that can be shared to the other members of your team. So I see that we got quite a few people entering information into that now. That's great.
So we're going to update this TA session, and we'll be sending the invite to the primary and secondary contacts. When we have a financial, because and I know a lot of times financial people are on the call and like, I really didn't need to be on this call. We will send, if it's going to be related to finance, we'll send it out to the financial contacts also. But the primary contact is going to be responsible for, forwarding. So if there is a TA session, like, we're going to do the system, we're going to talk about data entry, or we're going to, or if we're going to be doing like professional development and doing like taking case notes, and you need to have your case people, your, case managers on that, then it'll be your responsibility to forward that invite to them so they can participate. So anybody can participate on these TA sessions. We just want to make sure the right people are on it, and we're not having people on the TA sessions that it is not relevant for them to be on. Does that make sense? So, and I know we get that a lot with the financial officers. They're like, this really isn't relevant to what I need to do. What do I need to know? So we want to make sure that we're including the appropriate people in the appropriate sessions. And then once again, you need to keep this updated. It's your responsibility. So if your primary or secondary changes, or if your financial contact changes, it's on you to make sure that information is accurate.
And I would recommend bookmarking this page. The one reason I don't want to post it on Illinois Worknet is just in case someone, wants to throw a wrench into things, and we have it posted in a way so that anybody can edit it, that, someone completely erase it or, cause any frustrations that way. So definitely recommend bookmarking this page.
And this way it's not as public through this. It's just, you individuals who are getting into this. Does anybody have any questions on this? I love it. Look at you guys. You're going to town. You're doing this quickly. I love it, love it, love it. So if no questions, we're going to jump into the next part. And then, like I said, once again, we've thrown a lot of information at you, especially with the Worknet system, quickly. And I know it's a lot to take in. So we just want to give the opportunity for David to do another overview of the system. And then we want you to be able to, ask questions, because I know some of you have been in it already and entering information. So is there any questions related to, that? Or anything related to this? And like I said, once again, those of you that do not have programs in it, you've not been in the system. So we need to make sure that you're getting in, and David will walk through their open office hours. And then he'll also, after that, he'll walk through where the resources are, and you can find out where the eligibility, allowable eligibility documents are. So David, with that, I'm going to turn it back over to you again.
All right. So, okay. So to access JTED, if you don't have access to it, send Natasha and I an email, and we'll make sure that you do have access to the JTED system. But once you do have a Worknet account, you'll log in, and then under this My Dashboard dropdown, you'll select this cursor here, and under Partner Tools, you'll see Customer Support Center /iOS icon, and you'll click that. I'm going to go over to Test Environment now. You'll see it'll direct you to this customer support center page, and you'll see JTED project group listed. And when you select that, that will take you to the front page of where you add customers and to begin that process there. So to begin, it'll filter to you, the customers you've already added and you can access them. But to submit the customers, what you would do is click this add customer button, and then you would enter just this information here. So we'll enter the name, the date of birth, and the email. And the email again. Then the social security number. We'll confirm that again. And then we'll enter the zip code. And when we select this search for existing applicants, what's going to happen is the system's going to search to see if there's an existing Illinois Worknet account. And if so, it'll just kind of merge that information. But if there's multiple accounts on file, you may see a message that'll ask you to contact us. And then, if that is the case, then, we'll work through, and Natasha and I will check the system to make sure the right account, the right existing account is tied to this program. But if no account for the customer exists, you'll see a message like this, and it'll show that the username and password has been created. You can share that with the customer. And you can complete the initial application with the applicant. If you press this button, it'll take you right to the applicant. But if you click add next applicant, it's just going to show the window that we just saw where we enter that name, date of birth, social security number, and so forth. So you can keep entering the customers in that way. Or if you're ready to complete that application, you can press this button and it'll redirect you to the application page for the customer. And so for categories 1, 2, and 3, you'll have to enter the information here. We see at the top of the page, this first one is demographic and contact info. And then there's an eligibility check, and then education, skills and interests, and work history. If you're category 4, you're just going to enter in the information for demo and contact info. But we can see that the information that we just added populates over here. So then we'll just fill in the remaining blanks here. So we'll enter a street address and the city, state, and zip code information. And if you don't know the +4 for the zip code, that is required. We have a link here to the post office's website that you can identify those additional 4 numbers there. And we'll enter the phone number, the primary phone type. You'll enter marital status, race, ethnicity, the sex at birth. If they're authorized to work in the United States. And if you select male, you'll see that the fields added for is the customer registered with Selective Service. If yes, you'll be asked to enter in that service number. And then military status. And there's a few more here. Select the option that best describes your situation. So we have unemployed, received termination notice within last 90 days, qualified to have a higher skilled position than current job, situations that prevent the customer from working, and none of the above. And then we have how many people are in your household. And then we have what is your household monthly income. So you want to enter that information in here. And when we click, once we enter all the information on this page, we'll click the save and go to next page button. And what will happen is the automatic eligibility check. So then it'll check all the information that's been added and determine if the customer is eligible to participate in the program. And so we can see with the information that we entered, category 1, they are eligible, but for category 2, they don't meet the requirement. And if they're not eligible, it'll show, like we see here in red, what part of the application, was flagged as not meeting those requirements. And so we can continue with the application. And so then we'll just enter in the education history. We have some questions here. Do they have a high school diploma or GED high set? The level of education. Then there's a few other questions here if they've taken any tests, instructions, medical forms to fill out with job applications, some additional questions here that are optional. So those can be answered accordingly. And then if they have any credentials that they've earned through jobs and certificates, that sort of thing, you can enter the credential here by selecting this button. And then all you enter is the credential name, the date it was earned, the type of credential, and whether or not the customer has experience in that field that they've been trained in. So we'll click save and we can see that that's been added there. So we'll just go save and go to the next page. And then for skills and interests, we have a few required fields here. What are 3 things they'd like to get out of this program? That in for now, for the sake of time. And what kind of work would they like to do? You can select as many that apply for these remaining questions. What type of training would be best? And what schedule are they willing to work? So once we've entered that, we'll go to the next page here. And then the last part of the application is the work history. And if it's the current employment status is, if they've not worked before, this will be my first job. That's all that needs to be entered here. But if you select any of the others, you'll see some additional fields here. So let's say for this case, the customer, are you currently employed by this employer? And then we'll just enter in the employment information, the start and end dates of the employment, job title, and then the location of the employer. And then we have a few other fields here: job duties, hours worked per week, reason for leaving, was it their primary employment, and were they self-employed? And so once we've submitted this information, that completes the application. We see the application summary here for the customer. We can scroll down and see all the information we've entered. If we need to go back and edit any of that information, we can just click this hyperlink text here that's at the bottom of each section. Otherwise, if everything is good to go, you can press this return to intake button and it'll take you to this page for the customer. But while we're here, before we, I do want to show another thing here. So the landing page for submitting the customers here, we have the customers listed here. We can see that there's a hyperlinked name here. So for the customer that we just added, you can see right here in this entry here. And if we select this, the hyperlinked text here, it'll take you to the overview page of that customer. And so we're working on an update now that this will automatically refresh on a nightly basis. But when you press that button, you'll see the latest information on their enrollment status, referral status, training status, and status of barrier reduction support services. We can see also credential earned and just the overall program completion status. So we can check this page as we're entering information beyond the application to see where the customer is good to go, where they're all set, or where attention or action is needed. So I know we just entered the customer, but we can see that there's a yellow flag that we need to answer the status of enrollment. And so if we go to this intake tab, we can then enter in some of this information. So if we need to go back to that application that we just submitted, we can select this. It'll take us to that summary application page that we were just on. But we can see that number 2 here, we have the enrollment status. And so when we enter the enrollment status, we'll select whether or not they're enrolled. And if they're not enrolled, we have a few options to go: decline to participate, not eligible, application not submitted. But if they are eligible and they have enrolled, we'll select this. select the enrollment category for which category they are in. And then the training program that was previously added a few sessions ago. And we have, instructions and guidance on how to enter all this information that we'll get to a little bit later. But once we've entered the enrollment status, we'll click save, and we can see that that's been added here. And if I just go back to, just as an example here, we can see the enrollment status was a yellow flag, but if we refresh this, it says that should be a green flag. So I'm not sure why that is red at the moment, but that should be a green flag. Make a note of that. So, okay, after we enter the enrollment status, the next part is number 3, the services needs assessment. And whether or not this is needed, we do ask that this is that you do answer these questions. If it's not needed, no. That way, the overview page will show that this has been addressed. But this just asks if there's assistance needed for housing, transportation, dependent care, legal aid, healthcare, supportive services for education, training, and job placement, or other services. And if you select no, that's all that's needed there. But if you select yes, then filters will show, so you can specify what support services are needed. You can just check those boxes there. And that's the case for each one. Let's enter a few more. So click yes here. And when you do select one, you will receive a recommendation to assist the customer, if possible. And I'll enter yes for a couple of those, click no for these other 2, and click submit. So we've completed the service needs assessment, which we can see here, hyperlinked. Referrals, if any referrals need to be made, you can do so on this page, but if not, you can just check this box that none are necessary at the time. To submit a referral, you'll just click that button there. And if there's already organizations in here that you've added, all you have to do is click search. But otherwise, you can add a new organization by just entering the organization's name, phone number, address, city, state, zip code. Those are the required fields. And when you click save, what happens is that organization will then populate when you click that search button, so that you can then just plug that information in. And the same goes for searching for a contact. If you add a new contact, it's just name, phone number, email, job title. And then step 3 in the referral is the service or services that are requested. So then you can just check these boxes here and then enter in additional notes. And then once you click submit referral, see that the referral has been added here. In viewing, we can just see the information that was just entered. But additionally, if we need to resend that referral, we can just press this button here, and then the contact that we have listed here will receive another email for the referral. When they receive that referral, they'll get a link to respond to the referral. And when they do, this referral status over here will update. And going back to the intake page, step 5, the last step here, we have some information that you can provide the customer on how to access their career plan in Illinois Worknet. And you have that username and password that was created that you can send to them so that they can log into Worknet and access their career plan. And here we just have some talking points that you can use to cover with the customer and provide them with that information there. And so once this information has been provided to the customer, you'll just check the box here and then click go to the customer's training and services career plan. And so on this career plan page here, we have a lot of information. So we have, up at the top, that's just, the headers that we were on, that overview page for the customer where we saw that refresh button and the yellow, red, green flags. Intake is what we just completed. Referral, we saw that. And this is part of the training and services tab here. And program completion follow-up, that'll come later. But this is the overview page for the customer's career plan. And so we can see the profile, we can see their name and their email address. If we click see all, we can see additional information that was entered. If we need to reset the password for this customer, you can press this button here. And then we also have, related instructions and links to other tools within JTED over there as well. So on this overview page, we also have the ability to have a print version of the individual employment plan. And the down here we have the latest customer goals and plan agreement. We can select the plan status that if you're unable to get the customer agreement on file, or you have uploaded the agreement on file, or an electronic request for customer agreement, you can select those and then press the save status here. You can see we successfully saved the plan status. Then we have an overview down here. If the customer on Illinois Worknet under assessments, there's several assessments we have in Worknet that if they complete them when they're logged into their account and they complete these assessments, their scores and some information will populate here. And the same goes for their desired career path. If they select some occupations and wages, and when we enter some goals, we'll see this information populate here. And as they're completing the career plan, as you're entering the career plan information as well, any earned credentials, completed goals, completed services, these numbers will update here. Additionally, in the career plan, we don't have anything populated here, but first we need to add a goal to get this section to populate. We'll do that in a second. So we'll go to the next part here. So this is the first tab, overview. Next, we'll go to review assessment. And so I mentioned that there were assessments within Illinois Worknet that if they complete, their scores and information will be accessible. In this Illinois Worknet assessment section, for example, skills and interests, that's a survey or assessment that we have built into Worknet. As the customer completes it, it'll that information will populate here. And same for, all these other, tabs that we have under Illinois Worknet assessments. Additionally, if there's, another assessment that needs to be added that's outside of Worknet, you can enter that information here. And you can also add the assessment summary. And pressing this button, you'll get this, window to pop up, and then you'll select, the assessment summary for, we have a few topics here: readiness training, employment, independent living skills, physical and emotional health, leading skills. And for each of these, the boxes below are the same. So then you'll just enter in that information for the customer. What are their strengths? What will they do to improve? What their service provider can do to support them? What their family will do to support them? And are there other supports needed? So we'll just enter some example text in here for now. Click Save Changes. And if we click this summary tab here, you can see that the readiness training that we added, we can see that those assessment summary right there. So the next tab we have is titled Set Goals. So here's the goals that can be added here that address barriers for employment, credentials, any barriers that customer has as they're going through the career pathway that are these can be added in here. So then once we add a goal statement, we'll press this button here and we'll add a goal statement. So we'll say your job after program completion. Then we'll select the category. So let's say career plan, whether it's a short or long-term goal. And then the status. So it's a goal, but it just hasn't been started. Are they on track? Are they off track? Is it complete? So then we'll just add not started. We'll click add goal here. And we can see that the goal statement has been entered here. And if at any time, these need to be edited or removed, they can be as well. And then if we click this add under plan services, that'll take us to number 3, the add steps and services. And so to add steps and services, you can press this button here and you can search through and filter by category and service level. But and you can find which service needs to be added. So we'll click OK, we'll click add, and we see that that's part of step 1. Step 2 is actually assigning the service to a goal in step 3. So we see under step 3, step 2, here's that service that we added, occupational skills training. But step 3, here's the goal. And we see, the number 0 in parentheses here. So to assign this service to populating this goal, we'll select this pencil icon. And then we're taken to another page with more information that we can add about this service. And so this is the status homepage for this particular service, the occupational skills training. So we'll just enter the information here. The goal we entered was get a job after program completion. We'll select that goal. We'll select the planned start date for this goal. So let's say next Monday. If you have the SOC code of the program, you can search for it. Just entering in a keyword. You can start to just enter manufacturing, click search, and then we can see the results here. So we'll just plug in that. And so then we have the planned due date of the goal, say the end of next week, and how many hours a week are they planning on working on this goal? So let's just say 5. Additional notes can be added here. But something that we also need to change is the status up here, this asterisk. So it defaults to planned, not started scheduled. And this is important to update as these services are being updated in the system. Otherwise, that overview page for the customer that shows the status of everything, the red, green, red, yellow flags, it may flag as they haven't completed a certain thing. So be sure as you're entering these services that you're updating the status as well. So let's say they have started it at this, they're in process of this service here. We could add additional notes if need be. And if the service addresses some of the situations we have below, some of this information, this can be, the box is checked. So, if this service helped address, homelessness or transportation, you can check those boxes and say that. But we have a lot of situations listed here. So then what we're going to do is once we have this information on this status default page, we're going to click update customer service, and then we will be asked to leave a case note. So for the case note, we'll select the category, we'll enter a subject and message here. And then you can send the case note as a message to the customer. The email that is tied to their account, a message within Illinois Worknet. We have a messages tool built into Worknet here. So it can send this way, or it can send as a message and an email to that customer, or you can just save the case note without notifying the customer. But if you do want to send it to the customer as a message or email, you'll need to check this box in the other column here. But we'll add the case note. We can see that this has been updated. And if for just a second we go back to their career plan, we can see that under this career plan section here that the goal has been added. And so within that goal, we can see this one service, occupational skills training. We see that that has been, that started and opened. And so this status, overall says not started, but we can update that as well. So when we select that, it'll just go to that information we just entered. So we'll say that this customer is on track, and we'll save those changes. And if we just go back to the overview page, we can see that this status has been updated for this goal. Then going back to the occupational skills training service that we were on. So the status page we updated. Service provider, if there is no provider, I think that's the default, but whether it's your organization or another organization, that can be entered on this page, who is providing this service. And so you can just select that accordingly. If it's another provider, you can just enter in this information here. Let's just say it's one that we have on file. So then we'll add a case note once we update this information. So then that will be updated here. And depending on the service, there may be some differences in some of the tabs that come up here. Dollar value of service, if there's any cost associated with the service, this can be added here. You would just enter the service type, the service description, the payment method, the payment start date, the individual payment costs, the number of times offered at this cost. If it's a cost estimate, you can check that box. Then you can indicate how the cost was paid, whether it was grant, leverage resource, or referred provider. Then we have one last question, or one last item here. The service counts towards the maximum allowed subsidized days for the individual, yes or no. We'll just click save. See the service cost record saved successfully. And if we need to come back and edit or remove this, we can do so accordingly. Another tab we have here is attendance. So we can see that, with the planned start date and due date for the service, we previously said, next Monday to next Friday. And so if it's a longer range, you're going to have more entries here. If we put this for, 1 or 2 months, we're going to see, several more. But for this, attendance, during the week of, we said that also that we plan for 5 hours per week that the customer would spend on this. And so we'll select the week here. And for the dates and times, depending on the service, the dates and times that we can track how many hours they actually entered or actually spent doing the service. So then you can just for under check-in and check-out, you can enter a date range there. If there's an absence or a makeup session, this can be entered in here as well. And so then we'll go ahead and click save. We'll see that the weekly attendance has been saved. And then to verify it, if you can also verify that the customer did in fact complete 5 hours for this service on in this date range. Just click that and verify the service attendance. And so then that'll update there. And then last tab here is earn credentials. So with that service that they completed, if there is a credential to be earned, you can select this tab here, press the add credential button here, and then we'll just add name of the credential, the credential source, the date it was attained, the type of credential, the name of the institution that is administering the credential, and then a description. of that credential. So then we'll click save. You can see that that's been added. And then if we need to view the details, we'll come back in here as well. So then if we go back to if we select up here, training and services, this is going to take us to that customer's career plan homepage. So on this career plan homepage, we can see a few things here. We can see the case notes that we've added along the way, that those are saved here. If you need to add a case note, you can also press the button here to add one. And then, you know, once we've completed this service, you know, they've earned the credential, everything for this service is complete. What we will do is go back to the services, the service itself. So we can either click these, we saw what that led us to, that hyperlink text, but we can also go to add steps and services. So previously, when we had to assign these step service, it was, you know, under here under step 2, but, you know, in working through this, we can see that it's now under step 3, the managing and editing the parts of the service, which we did. And as we went through it, we can see, you know, in other items, the $ icon indicates that the customer service has a cost related to it. And this ribbon pin over here, that a credential was earned as a result of this service. But again, to update that status, we'll click that icon for the service and mark that they have successfully completed the service. And we'll enter the plan completion date. And then we'll click update customer service. We'll enter a case note. And then if we go back to the career plan, let me refresh this page. We can see here that the service that we just updated has been successfully completed, and that the goal, you know, going through the service that was a part of it, that this is completed as well. And so that's an example of, you know, going through the career plan and adding services. If I do want to also point out that, you know, early on we had each of the grantees add their training program under the provider info tab. And we also had, go over here real quick, entry grantee details. If the services are the same for all of your customers, on this grantee details tab down below, if we scroll to services, we see a section here of the services, and they'll populate based on, you know, what categories that you're, you know, a part of. But if you click this edit services to use on career plans button, you can go through the services, and if they are all the same for the customers, what you can do is check these services. And when you hit save, what'll happen is, as you're adding customers into the reporting system, when you add them, you complete the application and you get to their career plan, they'll automatically populate here. That way you don't have to go to this tab and individually add, if you had 12 services for 100 customers, you wouldn't have to do that hundreds of times, dozens, hundreds of times to add each service individually. So what you could do is just bring all those services over, kind of in one swoop. But if there's variation depending on customers, you can add others accordingly. And I think the only other thing is we also have on the training services, this is their career plan overview page. We just have this one tab over here, the update log. And this just shows the changes that were made and performed in the system for the customer. What section was it? What was the action that was completed? When and by which user? So with that, I saw that got a lot of messages in chat, but I'm going to take a look. I don't know if there are any outstanding questions.
Yeah, there's a few I've been responding to as we're going. And the social security numbers, yeah, they are required. We can have a conversation around that though, because we do have an organization that's we're working with outside of this on that. Let me see if I can. Martha said on one application, it prompted me that the individual needed a referral to adult education. He is a college student, so not sure why this prompted me this way.
Martha, I'll follow up with you about that. I'm not sure, at least offhand, why. that
Unless for some
prompted.
reason she selected that in the assessments, but yeah, you follow up with her.
Yeah, I'll follow up with you, Martha, about that.
And then we had a question, this is Martha too. Where do we access the documents when we send them electronically, in their email address or the Worknet account?
So I guess which documents would this be in reference to? Would this be?
Yeah, this is Martha. When we want them to sign their plan electronically, they're asking me, will that show up in their Worknet account or in their Gmail account?
I'll have to double check, because I think this is something that we are in the process of that we're working on. I don't believe there's any automated action going on. I'll have to double check that.
And that was something we discussed, I think, 2 weeks ago, where we do want the customer's signature saying that, you know, especially on the application, that they confirm that all the information is accurate and correct.
Yes, yeah. But so yeah,
And
we'll
then
have
that's the printable
something.
document. I think that they're going to put a button up there where you can print it, and then they can sign it or potentially sign it electronically.
Yes, yeah. So that is something that we are working on, that we're going to have in the near future here.
Okay, and please, could you go to your office hours and show them what you've got, and then also show them the resources, like for where the eligibility documentation is at?
Yes, absolutely.
Okay,
So
so you definitely need to use your office hours if you want to set up your training programs, or if you have questions related to entering information in the system.
absolutely. So we have the, I'm just going to show this link. It's just a good one to have. This is the partner guide that we have for JTED. So we have tons of resources, you know, a link to the dashboard, list of resources, upcoming and past, you know, recordings and technical assistance sessions like the one we're having this morning. The partner tool updates as well, any updates to JTED, we'll add them here. But for office hours and upcoming sessions, if you click under all resources, this button here, technical assistance, tutorials and videos, you'll get a calendar view, and we're going to update this with, you know, additional hours. But you can see that we have, looks like, yeah, this afternoon and, you know, next week, there's a few office hour sessions that either Natasha or myself will be in, and we have, you know, the date and time and a link to join that session there. And, you know, during that time, if you have any questions, or, you know, you've run into something on Worknet, or you're just not sure about something on Worknet, you can join that meeting, and Natasha and I will assist you as well. But this is how you can find the upcoming technical assistance webinars. And every Thursday we're recording these meetings. And so, you know, later today, under this archive technical assistance webinars section, we're going to add a row for today. And in last week's session, I need to do a new share here. Sure. Okay. So in last week's session, we added a document. We added a few, several documents here that you can use. We have, you know, links to a recording. Let me just open this up real quick. And for each of these category 1, 2, and 3, 4 applications, we do have a Word document that shows what the qualifications are. And this is part of that eligibility check that'll determine whether that customer is eligible or not. But it does just show, what are the criteria for being eligible for the categories and the information that's required upon entering that for the customer. And the text that's read, that's going to be required. Those are going to be required fields. So we do have Word documents for each of those categories here, as well as additional documents for low and moderate income eligibility and eligibility requirements and documentation sources. And I do want to also, there's a couple documents here that I think are pretty handy. So the training checklist, JTED document, if we open this up. So this is a nearly one pager, but this just shows, what, as far as the Worknet side of things, how to use Worknet how to use Worknet for JTED. So we have, just initially getting set up on Illinois Worknet, adding, partners into the system, and we have, recorded webinars and documentation on, instructions, guidance on how to navigate those different components here. But what we've done in this document here is, if you still need to add those, training programs and credentials, the grantee details, we have a link to that, along with, a note that, in a session that we covered, a couple weeks back, we covered a lot of ground, and I have it set up so that it directs right to that moment in the video of when we start talking about, adding grantee details and then adding customers, going through the application and eligibility check, completing the intake and referrals process. And so we do have, recorded videos and instructions that go with those, actions in JTED. And then the other document that we have is the fully case managed customers for JTED. And this is just a brief document that just provides an overview of, how to log into Worknet, what's needed when you add customers into JTED, completing the eligibility check and application with the customer, completing the intake process with the customer, and completing the career plan. And so we do have it, kind of a high level overview of, the different components. And we also link to the instructional documents as well for each of these items. And so I did want to point out those documents that are available there, but also on that JTED partner guide page, the full list of resources. If you select this, this is also broken up in a way that, provides the instructions, how to get started on Worknet, outreach and recruiting, career planning, how to, and this is, essentially all that we covered today, adding customers, completing applications, the intake, the career plan, and we have links to those instructions as well.
So we're kind of getting over our time again.
I have a question, David. I'm sorry, Tammy. So when we first started this journey of going into the documents and completing everything, you said that we start with my dashboard, then partner tools, customer support system, and then you lost me after that.
Yes. So what you'll do is, you'll log into Worknet. Just log me out. So you'll log into Worknet. You'll select my dashboard. And then under partner tools, you'll select this customer support center icon. And then this will take you to the groups page. You're going to see a lot here in a second, but what will happen is you'll then see a listing for JTED project group. And when you select that, that'll take you to where you add the customers. And if you don't see that group, that means you don't have access to JTED. And if that's the case, just send Natasha or I an email, and I'm going to add my
Okay.
chat here.
Great, thank you.
Okay, I think we had one other question that we can ask on this, and then we'll skip on to the next thing. And please use your office hours because they're very beneficial to you guys.
David, this is
You don't have-
Monica. You broke up really badly, and that was exactly the information I was looking for right then. I had a question about that earlier.
Oh.
One of the question what we had was, can we enter attendance for entire cohort at once? And did you show that earlier where you can mark it? But if you had a cohort, can you do that for all of them at one time, or do they have to do that individually?
So we
That's with
do-
attendance.
Yeah, we do have a bulk attendance tool. Let me over here for a second to get a few links here. Okay, so make sure I'm not messing with any actual live data, but so yeah, when you are logged into Worknet, what you can do is, let me just close a bunch of these tabs. This is a lot. So when you're on Worknet, what you can do to enter multiple attendance things when you're logged in under personal tools, there's an icon here that should show for attendance. And when you select that, that'll take you to this page. And so what you'll do is you'll select the provider and then the activity, and you'll select the date range here. And so once you select that date, you can then see the customers that are tied to this provider, to this service for this date. And then you can enter in the hours for which that are part of that service, and then you can click save. And that way, yeah, to your point, you don't have to enter in if it's the same service, same information, you don't have to enter that in over and over again, but you can do it in one shot.
Okay, we are over time, and there's one other thing I want to show you guys, if that's okay. David, is it okay if I share my screen?
Yeah, absolutely.
And then he will post this on the resources too, so this is available to you. We are going to be breaking our groups out here because we have a lot of people, and especially like the barrier reduction, you guys do not need to be on all of these calls all of the time. You can without a doubt be on the calls if you want to. But there's a lot of information regarding, doing the career plans and case management that's not necessarily going to be applicable to you. So we're breaking up our JTED team. We're having the three of us, Rosa, Monica, and I take certain agencies. So Rosa is going to take in all the agencies that have youth programs or youth components in the programs. And then so this is her list of organizations that she's going to be working with. So she will be your direct contact when you're working with our office on any questions that you have. And then she can, if it's financial, she can, refer you to Josh or whatever, but she's going to be your direct contact at this point of time. And then Monica is going to be taking the adults and barrier reduction grantees. So that's her list. And then that you'll be using her as your direct contact when you have questions related to this. And then I am going to be working with adult only grantees. So this is my list. And so I will be your direct contact for this. And we will post this, like I said, in the resources. But with such a large group, we just need to kind of have like one point of contacts and move them into smaller groups so that we can manage all of these grants, effectively and respond to you guys' needs and questions and everything. So I wanted to share that with you. We'll be reaching out and probably setting up individual meetings, at some point in the future here soon. Just to kind of check in, see how you're doing. We'll be looking at your, as we're moving forward, your expenditures and your performance and Worknet. And if we're finding like there's issues or problems, we'll be reaching out and talking to you guys about those too. But just your point of contact, and just, if you have anything that you have questions on, please feel free to reach out to us. We may be referring you to like Josh for fiscal if we have to, or to Natasha and Dave if it's the system information. But we just want to make sure that we're doing a good job in, communicating with all of you and keeping you, and, giving you the information that you need. So, like I said, we'll post that. And with that, Monica or Rosa, do you guys have anything specific you want to mention too?
No, not at this time, but if anyone has any questions, please feel free to reach out to me and I will do my best to get you the answers you need and the support.
And then we're going to be populating, like I said, we're still developing our training plan moving forward. Barrier reduction, once again, if you don't want to be on this call, you don't have to be on the Thursday's calls. And we'll be working with you individually. Monica will be reaching out and working with you individually. And then moving forward, some of the things that we're going to be talking about with the procedures manual still getting really close. We're getting close to getting it done. So that's going to be something that we're going to be presenting on soon. And then we're still working on finalizing the application templates that we can provide to you guys. And then we're also working on the self-assessment form, which is a larger project with some of the other grants that we're working with too. But we hope to have that information to you by next week. So with that, we're definitely over the time. So we're going to let you guys go. And if you have any other questions or concerns, reach out to your appropriate team leader. And then if it's anything that deals with the Worknet system, reach out to Dave and Natasha. Everybody have a great day.
Thanks, everyone.
Thanks.